If you're considering breast augmentation, one of the likely things you're thinking about is what type of implant should I get? What size? What profile? What material? Which brand? All these questions are probably running through your mind, and you're probably getting very confused because your girlfriend got implants and she got 300 cc's and they look great, and you're thinking maybe I should get 300 cc's because I want to look like her. None of these things matter, honestly. The first thing you have to do is go visit a board certified plastic surgeon who can explain your options to you, because implants are very complicated. You've got various styles, you've got various manufacturers. For example, you've got these that are moderate profile, then you've got a low profile, then you've got a high profile. They come in different widths. You can see this is wider, this is narrower, this one's a little in between. So how do you choose which one to get? Well, first of all, people will ask me, is that a C-cup implant? And my answer is there is no such thing as a C-cup, and there is no such thing as a C-cup implant. Each implant is capable of giving any individual person a different result. Implants come in volume measurements. These are cc's or cubic centimeters. And this same implant can give one woman a B cup, another woman a C cup, another woman a double B cup. It all depends on where you're starting. And how do you choose which profile? If you want a high profile implant, that means you're likely to get a more rounded looking breast with more projection this way. If you choose a low profile implant, well, generally speaking, you're going to get a more natural tapered looking breast with these. And this is kind of like the middle of the road. Again, these are all just generic comments. They all can be modified based on the anatomy of an individual patient. I may choose to use a moderate profile implant on one side and a slightly lower profile implant on the other side if there's significant breast asymmetry to begin with. If the chest wall is more full and projected on one side, where the ribs are just more prominent and it pushes the breast outwards on one side and not the other side, well, you have to account for that when you're examining and understanding how to choose an implant. Again, lots of different choices, no wrong answers, but again, it requires an in-depth understanding of anatomy, an in-depth understanding of implants and how they interact with the breast and the skin and the breast tissue to give you a good result.